Hi, I'm Randy Avers. Welcome back. So if you made it this far, I just want to let you know this is an advanced course. So you have to make sure that before you attempt to complete this course that you saw my other course on how to isolate and overcome any objections, or else a lot of this won't make sense. There'll be a lot of holes, a lot of things left out. Because I'm going to make a lot of assumptions here before I get into this first part about when the patient says it costs too much. I'm going to make an assumption that you did a fantastic greeting. You got massive rapport with the patients. You did a fantastic need analysis or dig for purpose. You know why they want to get this done. You know how it's been bothering them, how long it's been bothering, what the final tipping point was for them to finally make it into your office. You know their life situations, that they're not smiling anymore, they're not smiling in pictures. You know their motivations, that maybe their daughter's getting married next month and they want to look great in a photo. You already know that they are single for the first time because you did a great job at the first three steps, which was the greeting, the need analysis, and then the presentation. So you've already presented the fees here, and you may have presented them in an alternative choice. Okay, so to take care of your immediate needs, you know, that crown, that cracked tooth will be this. But to take care of the 8 in the front that have been bothering you for the last 10 years, it would be this. And then when you do it together with the crown, you get a bit of a savings, maybe 10% savings. So which would you prefer? Would you like to just take care of that crown, the cracked tooth right now, which you have to do, or get it all done at once? Which would you prefer? So now, this is where it begins. In the past, in the other modules, one of the things that I recommended to do, or the main thing I recommended, was to agree the way you handle an objection when they say, it costs too much. And I want to identify it costs too much in this chapter as an advanced way to handle this. When they say it's cost too much, you're going to say, okay, that means you agree. You're going to say, aside from cost, is there anything else causing you to hesitate? And they may say, yeah, X, Y, Z. And it allows you to deal with it. But another way to handle it, which I don't think we've really introduced so far, and that is a direct feedback. It costs too much, and you're going to say, they're going to say, it costs too much. This is way more than I wanted to spend. You're going to say, this is way more than you wanted to spend, and then you're silent. You don't say a word. Or if they say, this costs too much, like it blurts out of their mouth, you could say, it costs too much, and then you're silent. Allow them to talk, because sometimes some people, we all know people like this, they think out loud. So some people, because it's emotional, they've been in pain, they've wanted to do it for so long, and in a way they're let down. They're going, what they're really saying is, I can't believe it costs so much. Not that they think it's too much for what you're offering. They're just making a statement like, it costs too much. This is more than I wanted to spend. They're not putting you down. You cannot take this personally. So follow the standard procedure, which is agree, ask, is there anything else? The advanced technique is, it costs too much. This is more than you want to spend. Let them talk. So the next thing you want to say, when they say, no, it's just about the money, then you can say, what did you think something like this was going to cost? What did you have in mind? Oftentimes they're going to say, I don't know. I really didn't know what to expect. You have to dig. Don't let it go here. I mean, some people say, well, no, you want to say, how much? About how much? Like when you were driving over here, what did you think something like this was going to cost? And after a few, digging and digging. See, sometimes they know what they were thinking it was going to cost. They might have said on their way over, you're showing them a $15,000 a treatment plan, and they were thinking shouldn't be more than $2,500. So they're ashamed sometimes or embarrassed to tell you they thought it was going to cost $2,500. So you have to dig and dig. The truth will come out at the end. And say, you must have an idea. And they'll say, well, I thought it was going to be about $2,500. And you'll explain to them that you actually could do the crown for about $2,500. Or you can say, for $2,500, when you came in, you thought you just needed this, this, and this, but it turns out you've got several teeth that have some issues. You have some bone loss. It allows you to build value and explain and justify your price.